Have you ever thought that by eating well, you're safe from diabetes? Well, even with a healthy diet, there are invisible factors like stress, lack of exercise, or genetics that can put your health at risk. These factors can affect how your body processes sugar, increasing the risk of diabetes. The good news is that by understanding these triggers, you can take simple and effective actions to prevent the disease. Let's discover together how to change this and live with better health and well-being. But before we continue, write in the comments which city you're watching from so we can know where you're from. And make sure you're subscribed to the channel because I'm going to bring a series of videos that will help you control your diabetes and reclaim your health. Let's get started. 1. Genetics and family history. Have you noticed that some diseases seem to run in the family? Well, type 2 diabetes is one of them. If your parents, grandparents, or siblings have or had diabetes, your chances of developing the condition are higher. This happens because genetics directly influence how insulin works, the hormone responsible for regulating blood sugar levels. Some people are born with genes that make their cells less sensitive to insulin or that hinder proper insulin production. Over time, this can lead to higher blood glucose levels and, if not controlled, the development of type 2 diabetes. But here's the good news. Genetics is not a sentence. Having a family history simply means you need to pay a bit more attention to your lifestyle. Maintaining a healthy diet, rich in fiber and low in refined sugars, exercising regularly, controlling weight, and avoiding harmful habits like being sedentary can drastically reduce the risk of developing the disease. In other words, genetics may give you a nudge, but you decide the path. Now tell me, are there cases of diabetes in your family? Has that made you rethink your habits? 2. Obesity and excess weight. Did you know that being overweight is one of the biggest risk factors for type 2 diabetes? That's because accumulated fat, especially in the abdominal area, directly interferes with how insulin works. The more visceral fat, the fat around your organs, the greater the resistance your body has to insulin, causing glucose to accumulate in the blood. Additionally, fat tissue releases inflammatory substances that further disrupt metabolism. Over time, the pancreas has to work harder to produce more insulin and compensate for this resistance. But it has a limit. When it can no longer handle the demand, blood sugar levels skyrocket, increasing the risk of developing diabetes. The good news? Losing just 5% to 10% of your body weight can make a huge difference in controlling blood sugar. Small changes, like improving your diet, cutting down on refined carbs and sugars, and exercising regularly, help your body regain its sensitivity to insulin and prevent future complications. If you're overweight, how about starting with small changes today? Your body will thank you. 3. Diet rich in sugar and refined carbohydrates. You know that white bread, that cold soda, or that irresistible sweet? Well, consuming these foods often can be a big problem for your health, especially when it comes to type 2 diabetes. Refined carbohydrates and sugar are digested quickly, causing blood sugar to rise like a rocket. This forces the pancreas to produce more insulin to keep up. Over time, if this overload is constant, the body may develop insulin resistance, making it even harder to control blood sugar levels. But don't worry, this doesn't mean you need to cut out all carbs from your life. The key is to make better choices about what to put on your plate. Prioritize complex carbohydrates, like those found in whole grains, legumes, and vegetables, which are digested more slowly and help keep sugar levels in check. If you feel like you depend too much on sugar and refined foods, how about starting to make smart swaps? Small daily changes can prevent big problems in the future. 4. Sedentary lifestyle. Staying inactive for long periods of time can be more dangerous than you think, especially when it comes to type 2 diabetes. A sedentary lifestyle, or a lack of regular physical activity, is one of the main risk factors for developing the disease. When we spend the entire day without moving, our muscles don't use glucose, sugar, efficiently, which leads to an increase in blood glucose levels. Additionally, lack of exercise contributes to weight gain, especially abdominal fat, which is one of the most harmful types for your health. This extra fat further impairs the proper use of insulin, making the body resistant to this hormone and increasing the chances of developing diabetes. The good news is that you don't have to become an athlete to protect your health. Simple activities like walking, swimming, cycling, or even dancing can make a huge difference. The key is to get your body moving, burning energy, and improving insulin sensitivity. The recommendation is to exercise for at least 30 minutes on most days of the week. And it doesn't all have to be at once. You can split it up, like doing 10 minutes in the morning, 10 minutes after lunch, and 10 minutes in the evening. The secret is to build the habit and make movement a part of your daily life. So, how about starting with a light walk this week? Your body will feel the difference, and you'll be on the right path to a healthier life. 5. Insulin resistance. Insulin resistance is one of the main factors contributing to the development of type 2 diabetes. But what exactly does this mean? Insulin is a hormone produced by the pancreas that helps the cells in your body absorb glucose, sugar, from the blood to use it as energy. When you have insulin resistance, your cells can't use insulin effectively. This causes the body to produce more insulin to compensate for this failure. But over time, the pancreas can no longer maintain high production, and glucose starts to accumulate in the blood. This insulin resistance can be triggered by various factors, such as obesity, a sedentary lifestyle, poor diet, and even genetic predisposition. When a body can't effectively control blood glucose levels, the risk of diabetes increases significantly. The good news is that insulin resistance is not something you have to accept as your fate. With lifestyle changes like a balanced diet rich in fiber and low in refined sugars and regular physical activity, it's possible to reduce insulin resistance and improve blood sugar control. Weight loss also plays a crucial role, as it helps improve the cell's sensitivity to insulin. So, if you feel you might have insulin resistance, how about starting today to make healthier choices to prevent future complications? 6. Polycystic ovary syndrome, POS. Polycystic ovary syndrome, POS, is a hormonal condition that affects many women and has a strong connection with type 2 diabetes. Women with POS have an excess production of male hormones, like androgens, which can interfere with the normal functioning of the ovaries and make ovulation difficult. But the impact of POS goes beyond that. It's also associated with insulin resistance. This means that, in addition to hormonal issues, women with POS have more difficulty controlling blood glucose levels, increasing the risk of developing diabetes. The link between POS and diabetes is even stronger when the woman is overweight or obese, as excess weight worsens insulin resistance. Moreover, women with POS often have higher levels of triglycerides and blood pressure, which can contribute to the development of cardiovascular diseases. However, the good news is that POS can be managed and the risk of diabetes can be reduced. Lifestyle changes, like maintaining a healthy weight, exercising regularly, and adopting a balanced diet, can improve insulin resistance and POS symptoms. Additionally, some medications can help regulate ovulation and reduce androgen levels. So, if you have POS, the key is to manage your overall health. With medical supervision and a healthy lifestyle, it's possible to minimize risks and live in balance. 7. Sleep disorders and sleep apnea. Did you know that a good night's sleep is essential for controlling diabetes? Sleep disorders, such as sleep apnea, can directly affect your health and increase the risk of developing type 2 diabetes. Sleep apnea is a condition in which breathing is interrupted multiple times during the night, leading to low blood oxygen levels and increased blood pressure. When the body doesn't rest properly, it can impair glucose metabolism, making it harder for the body to use insulin efficiently. Additionally, chronic sleep deprivation can raise cortisol levels, the stress hormone, which can cause blood glucose levels to rise. People with sleep apnea are at higher risk of developing insulin resistance, which can trigger diabetes. But here's the good news. Improving sleep quality can have a big impact on your health. Treating disorders like sleep apnea with the help of a doctor can improve rest and, at the same time, help control blood sugar levels. Additionally, maintaining a regular sleep routine, avoiding stimulants like caffeine before bed, and creating a calm and comfortable sleep environment are simple habits that make a difference. If you find it hard to sleep or wake up frequently during the night, it's worth seeking medical advice. Quality sleep is crucial for health, and with the right approach, You can improve both rest and diabetes control. 8. Chronic stress. Chronic stress can be one of the major villains when it comes to controlling blood glucose levels. When we're stressed, the body releases hormones like cortisol and adrenaline, preparing the body for action. This response is helpful in short-term situations, like moments of danger, but when stress becomes constant, it can disrupt blood sugar regulation. Cortisol, for example, can increase glucose production in the liver, raising blood sugar levels. Moreover, chronic stress can also lead to behaviors that worsen glucose control, such as overeating sugary or fatty foods, smoking, or neglecting physical activity. These habits, in turn, can contribute to the development of insulin resistance and increase the risk of diabetes. The good news is that there are many ways to reduce stress and improve glucose control. Relaxation techniques such as meditation, yoga, deep breathing, and even walking outdoors can help lower cortisol levels and improve the body's response to insulin. Furthermore, maintaining a good balance between personal life, work, and leisure, having hobbies, and dedicating time to yourself are essential for effectively managing stress. So, if you feel stress is taking over your life, it's worth investing in strategies to reduce it. Your health will benefit, and controlling diabetes will become much easier. How about trying a relaxation technique today? 9. Prolonged use of certain medications. Some medications, when used for a long period, can increase the risk of developing type 2 diabetes. This happens because certain drugs can interfere with how the body uses insulin or affect glucose production. For example, medications like corticosteroids, used to treat inflammation, and some antipsychotics can cause weight gain and insulin resistance, making glucose control more difficult. Additionally, some medications for hypertension and cholesterol can also have adverse effects on glucose metabolism, increasing the chances of developing diabetes over time. Although these medications are important for treating other conditions, it's crucial to closely monitor potential side effects and discuss alternatives or ways to control them with your doctor. The good news is that with proper medical supervision, it is possible to balance the treatment of underlying conditions with diabetes prevention. If you're taking long-term medications, it's always important to talk to your doctor about their impact on your glycemic health and seek ways to mitigate the risks, such as lifestyle changes, diet, and exercise. So, if you take medications regularly, be sure to discuss with your doctor how to protect yourself from potential side effects, such as the increased risk of diabetes. With the right follow-up, you can take care of your health in a balanced way. 10. Autoimmune diseases and pancreatic issues. Autoimmune diseases, in which the immune system mistakenly attacks healthy body cells, can also be directly related to the development of diabetes. In the case of type 1 diabetes, for example, the immune system attacks the beta cells of the pancreas, which are responsible for producing insulin, leading to insufficient insulin production and, consequently, elevated blood glucose levels. However, even in people with type 2 diabetes, who typically have normal insulin production initially, autoimmune diseases affecting the pancreas can worsen insulin resistance or interfere with the functioning of the organ. When the pancreas can't produce insulin effectively due to an autoimmune condition, it can result in high blood glucose levels, increasing the risk of diabetes complications. Furthermore, conditions such as pancreatitis, pancreatic inflammation, or other issues affecting the pancreas can also impair insulin production, leading to the development of diabetes. The good news is that, with proper medical monitoring, autoimmune conditions can be treated to minimize pancreatic damage. Lifestyle changes, such as a healthy diet and regular exercise, are also crucial for maintaining pancreatic health and preventing complications associated with diabetes. If you have an autoimmune disease or are dealing with pancreatic issues, it's important to maintain regular medical follow-ups. With appropriate treatment and a proactive approach to health, it's possible to control blood glucose levels and minimize the risk of diabetes. Now that you know the invisible factors that can increase your risk of diabetes, it's time to take control of your health. With small changes in your daily life, you can prevent the disease and live a better quality of life. So, if this video helped you, don't forget to like, subscribe to the channel, and leave a comment below telling us what you think. That way, you won't miss any content that could make all the difference for your health. See you in the next video.